5 lives per day. 5 people die every day. In 2023, our state recorded more than 1,800 confirmed opioid-related deaths and thousands more non-fatal overdoses. As a border state through which illicit fentanyl is trafficked, Arizona youth are particularly vulnerable to the frontline effects of this battle. This is a big problem of us being a border state. Half of the fentanyl in the country comes through Arizona, and that's what happens when you're a border state and a terrible thing like fentanyl is coming across the border. Today we are announcing that a school training overdose preparedness and intelligence task force is being formed. The acronym is called STOP IT, and you can see here in our board, School Training Overdose Preparedness and Intelligence Task Force, or STOP IT. This will include representatives from schools, healthcare, law enforcement, and other interested stakeholders. Its meetings will be open to the public and to the press, as was true with our school safety task force. Among the first organizations to lend their support are Terrace Health and the Mayo Clinic, who are with us here this morning. I also want to thank the Sold Out Youth Foundation, a nonprofit organization that provides to schools at no cost interactive online materials, warning of the dangers of illegal drugs, a quality fentanyl education curriculum, and an online platform promoting health and fitness education. And we intend to make all these materials available to the students in the schools before school's let out. So we're going to act very quickly so that they'll have the materials over the summer and know what to avoid. Sold Out Foundation is a valuable partner in our effort. Naloxone, or Narcan, is a life-saving medication that quickly and temporarily reverses an opiate overdose with virtually no side effects. This allows time for the overdosing person to be transported to a hospital so he or she can get the care they need to recover. Arizona laws require schools to have policies and procedures regarding emergency administration of naloxone. Our task force, KTR News, is the tape. You need more tape. Our task force will help the schools with that statutory requirement. Sadly, overdoses are a reality for school-aged children throughout Arizona. Fentanyl can kill students within minutes of an overdose. It is vitally important that all schools have Narcan available to help save student lives if it should happen on campus, and it's affordable. The retail price is $45 for two doses. With the establishment of the Stop It Task Force, we will work to get Narcan into the schools and assist training for use. I am also endorsing the work of the Sold Out Youth Foundation, which has excellent resources to address this ongoing crisis, and the educational efforts are as important as the Narcan in the schools effort because of the number of students who have died at home from overdosing. I'm going to ask, first of all, Mike Kurtenbach to come up. He's our Director of School Safety. And then I will have, after him, Dr. Holly Geyer from Mayo and David Shatt from Terrace Health. And maybe, where's our KTR News person? Maybe, do you have some more tape, maybe? Because it keeps falling over.
Stop smacking it.
Huh?
Stop smacking it.
Because I gesticulate so much, Howie.
Should be good.
Thanks. Okay, so let's start with Mike Kurtenbach.
Thank you, Superintendent Horne. As the superintendent said, my name is Mike Kurtenbach. Prior to being appointed as the Director of School Safety by the superintendent, I spent over 32 years with the Phoenix Police Department, serving in various capacities. As a Phoenix police officer, I saw the effects of fentanyl firsthand. In fact, I was part of a team that ensured that all Phoenix police officers carry Narcan with them so they, as first responders, can reduce the loss of life in our communities. And this was really pronounced the first time I saw on body-worn camera a Phoenix police officer exposed to the drug and saw the power of Narcan bringing that officer back. In this role today, it is critically important that we ensure that those that are most vulnerable in our community aren't affected by this drug or lose their life unnecessarily. And when I was introduced to Dr. Geyer and Mayo, I already have a profound partnership with Taros Health. It just made sense to, under the auspices of Superintendent Horne and the Arizona Department of Education, to bring these partners together along with the Sold Out Youth Foundation to first off increase awareness, and then if God forbid there is an exposure, to ensure that we have the requisite drugs on hand to address it appropriately. So I'm very grateful to Superintendent Horne for seeing the value in this partnership, for affording us the opportunity to lead this effort. And with that, Superintendent, I will turn it over to Dr. Geyer from Mayo.
Thank you so much. Superintendent Horne, thank you for the opportunity to be here today. Thank you for the chance to start this task force. As a mom, as an addiction medicine subspecialist and a hospital internal medicine professional at Mayo Clinic, I have seen the toxicities of these drugs firsthand. I have resuscitated people that are dying from fentanyl, and the numbers are growing. We recognize that roughly 80 kids lost their lives to drug toxicities just in the last few years. These are our children, and they're happening in small ages, even juvenile, under high school age. And so there is a tremendous need to get education into our school systems. We are privileged to partner with many, many fields, disciplines, and expertise across our state to bring together what we hope to be a compassionate and comprehensive, well-educated, and well-versed subcommittee that's going to address these topics. Between making sure that our students have access to naloxone and in a quick and easy basis to make sure that they're trained on the toxicities of these drugs and how these drugs differ from standard opioids that are provided pharmacologically through a provider or a practitioner, as well as training the staff members that need to ensure that these are available throughout the school systems and make sure the schools that they have the policies, the procedures, the manuals ready to go. On top of that, we want to make sure that the supply chain is secured so that when these naloxone supplies are replenished, they're quick and easy to access and at a cost-affordable opportunity. So we're so pleased to be partnering with these many partners that I believe are going to bring solutions to our school systems, and appreciate all of the Department of Education support to do so.
Thank you, Dr. Geyer. I want to thank the Sold Out Youth Foundation for their help, which is crucial. Their CEO, Roman Gabriel, I want to thank him as well. He lives in North Carolina, so he's not able to be here. Our final speaker before we take questions that you can ask of anybody is David Shad. Now, I do want to thank Dr. Karen Hoffman-Tepper, who's the CEO of the Taros Health. She's unable to be here, but she's very supportive of these efforts. And Dave Shad will speak and also will demonstrate the use of Narcan.
Good morning. My name is Dave Shad, and I'm an emergency management specialist at Taros Health. Today is a milestone day for Arizona and our state's youth. At Taros Health, we are proud to join Superintendent Tom Horne, the Arizona Department of Education schools, health partners like Mayo Clinic, and stakeholders in launching the School Training Opioid Preparedness and Intelligent Task Force, or STOP IT. This will help curb the growing number of fentanyl overdoses in our state. Prescription opioids like oxycodone, morphine, Vicodin, and illegal opioids like counterfeit pills with fentanyl are additives and deadly. Taros Health has been on the front line of this crisis since it began back in 2017, and we know that far too many young people have been affected by the harmful effects of this substance. Thankfully, there is a life-saving medication called Narcan that can help reverse an opioid overdose from heroin, fentanyl, and prescription opioid medications in minutes. Taros Health has been training people of all ages and from all walks of life in dispensing Narcan. To date, we have conducted over 10,000 training sessions, including of hundreds of students and teachers. We believe everyone should have this access and be able to be trained in the use of Narcan. We must think of it in the same way we think of CPR. as a tool that can be saving lives. With that in mind, we look forward to working with our partners to make Narcan available to every school and every community throughout our state. Thank you.
Thank you, and I think you're going to demonstrate.
Okay, who's the victim here?
We don't need,
We think the school chief should be the victim.
not needed. So Narcan nasal in a box comes 2 doses that are sealed like this. This life-saving device can help individuals. When you administer it, it can reverse the effects in possibly 15 seconds. The box has 2 doses because statistically you need 2 doses. To use Narcan, you take the one out of the container, you put 2 fingertips on the top, 1 on the plunger, up the nose until your fingertips touch the top of the nose. You push the plunger up. It's very important to hold it into place for 5 to 10 seconds so all the medication goes inside. This would be 1 dose, 4 milligrams. When you're done, you dispose of it in a trash can, biohazard can. Second dose will be needed 2 to 5 minutes. I always recommend going to the opposite nostril. Thank you.
Thank you. So I guess now we're happy to take any questions anybody has. Yes.
Superintendent Horne, I'm trying to kind of better understand this. What is the timeline looking in terms of this task force, and when could we see, distribution of Narcan in schools? And is the goal to get that, one in every classroom, available at nurse's office? What does that?
Yeah, those. First of all, the task force will be formed immediately, and some of the things that need to be done immediately we'll try to get done by the end of May. But the other questions you asked are questions that will be answered by the task force. Whether you should keep it in the nurse's office, to keep it in every classroom might be somewhat expensive. But the task force will deal with those problems. And their meetings, as I say, will be open to the public and to the press, and we'll make that information available as soon as the task force arrives at it. Howie?
You and I have been around a while.
Yeah.
We've seen programs like DARE. In a lot of ways,
We've been around together since 1997, as I remember.
yeah, I'm not sure if I'm older than you, but we'll talk about that. There have been various programs, demand reduction, all the rest of that stuff. And the record on programs like DARE is they spend a lot of money, they don't produce a lot of results. I've heard the joke that, the DARE program, hey, these are some drugs I should try, now that you've got somebody in the school saying that. What makes you believe this is going to be any more successful than DARE has been?
Well, I think the unique thing about fentanyl is that it kills, and it kills rapidly in the case of an overdose. And in some cases, people don't know that they're taking fentanyl because it's mixed in with other things. That's one of the tragedies, is students who die without ever having made a decision to take fentanyl. And so we're going to, as I mentioned, we're going to get the literature out to the students about, before they go home for the summer. And we're going to work as fast as we can with the task force to make decisions about how we distribute the Narcan to the schools, because it can save kids' lives.
But you point out that sometimes kids are not necessarily looking for fentanyl.
Right.
They're looking for something else.
Yeah.
Kids have been taking drugs, how many generations now? So what about this program?
When I was a student, the worst thing that kids could do was chew gum.
Well, you are old enough. But the fact is that it's nice to have the Narcan in the schools, but again, how do you convince kids who are looking for, whether it was alcohol from parents' liquor cabinet, going back, if you will, to the 50s and 60s or whatever, that they shouldn't take a drug? Again, the programs I have seen have not worked. It's like the old joke, we know about the war on drugs, drugs won. So again, how is this going to be different?
Well, with respect to the Narcan half of it, it's different in that it will actually save lives. It will make the Narcan available in the schools, so if a student has an overdose at school, they can be treated right away. With respect to the educational part, I've expressed my appreciation to the foundation that is making materials available. We will give the materials to the students, and we'll do our best. The worst thing in the world would be to do nothing, and to be pessimistic and do nothing. We have to do everything we can because kids are dying, and when parents have a kid die, they never recover for the rest of their lives from that.
Are there any numbers on how many students have overdosed in the past few years?
Yes, I do. For the data for 2021-22 is that at least 80 children under 18 were claimed to overdose. 7 of them died in middle school age, and 4 actually died in school. They could have been saved.
That was in Arizona.
That's Arizona.
Any advice to parents about, before they even get to school, talking to their kids about mitigating drug use?
Well, yes, and that will all be developed by the task force that we're forming. But we will be communicating with students and with staff at the schools and with parents.
Is the department going to be providing money at $45 a dose? We have, 2,000 school districts, Lord knows how many buildings. I mean, is the department going to be providing the money for these Narcan doses?
We have 2,000 schools. We have about 200 districts. For these things cost, one of the things the task force will be working on is getting wholesale prices for them, or possibly for free, but certainly wholesale. So that'd probably be at least half. So you're talking about $25 a dose. So the schools can afford that out of their M&O budgets, or in the district can afford it at $25 or $50 per school minimum. And so that, I think that'll take care of it. If the legislature wants to appropriate money for it, that's up to them.
Has that been employed in other states, the buying it wholesale, or will this kind of be a first of its?
I don't know the answer to that. That's a good question. We'll check. Again, the task force will check into that.
Do any of you other folks, in terms of prevention, and again, I'm showing my age in the DARE program, former DP, police officer, whatever, what does work, to keep kids from experimenting? Any of you want to take that on? Because, like I say, my experience has been, and maybe it's my misspent youth in the 60s, I'll plead guilty to that, has been a lot of it just doesn't work. You kids say, yeah, right. And you want to take it on, come out to the mic.
I think the press has raised an absolutely excellent question, and we've asked it ourselves in the addiction field. When we look back at the DARE program, you're absolutely right. There were failures. In fact, in a number of states that employed it, use of drugs went up. And so that's a big concern. And when we look back and say, what were the components of that DARE program that probably enhanced interest by our youth? It was that oftentimes we would profoundly review all of the potential benefits, right? You're going to get high, you're going to get a buzz, you're going to make more friends, you're going to be socially accepted, but it might make your breath smell bad, right? Or you might get in trouble. What we didn't emphasize were those toxicities. Some of you might have heard of the Montana Meth Project. It was one of the most successful anti-drug campaigns in methamphetamine in U.S. history because they went into the toxicities. They literally scared people. They said, it's not if, it's when these kind of problems happen to you. And I believe now that we'll be working with the DEA on this task force as well, their One Pill Can Kill campaign will be integrated into this, because recognizing that 7 out of 10 fentanyl pills on our streets have enough fentanyl to kill the average American adult. Kids need to understand this is lethal, it is deadly, there is no role, no opportunity for experimentation in 2024.
Okay, but are you telling me, and I realize, we can go back to kids don't read papers or something else. You turn on a TV, you turn on the radio, you look at the internet. Fentanyl kills. You seem to be suggesting that message hasn't gotten across. I mean, it's been everywhere.
I don't know if it's been in all the social circles necessary to reach this population. We've done a lot of internal research, and we've identified that when it comes to doctors or providers, as we're trying to reach Gen X and Z, they're not listening to us. They're going to social influencers. And so that might be part of this campaign, identifying groups or individuals that are in their world that can relay this message, and probably much more impactful than we can. So we'll be exploring that.
So Twitter's presence, whatever. I mean, yeah.
A little more than that, but more to come.
I think Dr. Geyer gave excellent answers, and you can see why we always have experts in our press conferences. Any other questions? If not, thank you all for coming.
So we looked for your website, Tom, and your Twitter feed, your feed on Truth Social.
All those things.